Welcome back to the show. Our next guest, Dr. Andrew Miki, is a registered clinical psychologist practicing in North Vancouver and New Westminster. He obtained his PhD in clinical psychology from York University in Toronto. His expertise is in a unique scientifically proven form of treatment called cognitive behavioral therapy for a variety of presentations, including depression, anxiety, stress, and post-traumatic stress disorder. Welcome to the show, Dr. Miki.
Thank you for having me.
Dr. Miki, tell me a little bit about your background and the work that you do.
I was trained in clinical psychology out in Toronto, and I guess my specific areas of expertise has to do with a specific type of therapy called cognitive behavior therapy. And most of the people that I see in private practice right now, they generally are presenting with various levels of depression, anxiety, stress. And some people that I see have post-traumatic stress disorder, and other people have other presentations like traumatic brain injury.
Now, for the average person, what is cognitive behavior therapy?
Cognitive behavior therapy is a type of therapy, it's a type of talk therapy that focuses on the way that people think and their behaviors to influence how they feel.
Okay.
It's been, we call it evidence-based in the sense that there have been dozens of studies, research studies, that have shown, I guess, how effective it can be compared to medication and the combination of both medication and therapy.
Okay.
And what we generally find is that therapy alone and medication alone is about equally effective for mild to moderate levels of depression,
Okay.
and then the two in combination is the optimal.
So if we thought about cognitive behavioral therapy, if it's about thinking and behaving, then why therapy?
Part of it is to help people understand, I guess, how certain patterns are leading to how they're feeling.
Okay.
And if they have a better idea of how that's happening to them, they can then learn different tools or different strategies to implement it at that particular time to try to, I guess, manage how they're feeling at that time.
Okay, so if I came to you as a patient and I presented with something like anxiety, for example, how would you use cognitive behavioral therapy to help me with that, with anxiety?
The first thing that I would do is I would perform an assessment, just so that I have an idea in terms of the exact type of anxiety that you're bringing to the table, and also so I can have a gauge in terms of the severity and also how it's affecting your life.
Okay.
Once I have a pretty good idea in terms of that, then I can tailor the treatment specifically for you.
Okay.
So just to give you an example of how this works, I can walk you through just in terms of what I usually do with people, say, towards the end of the first session.
Okay.
So I could ask you to give me an example of somebody who might be anxious or depressed, maybe a certain situation that they find themselves in, where they're feeling relatively fine, and then what they experience is something called a mood shift. So all of a sudden they find themselves feeling a lot more depressed or stressed or anxious.
Okay.
So could you give me a situation like that?
A situation like that, probably something like, how about closed spaces? Is this a good example of when you walk into an elevator and all of a sudden you feel really anxious because you don't know if the doors of the elevator are going to open?
Yeah, I think that's a really good example of what we call like a specific phobia, something that somebody, something very, like I guess a specific object or situation that people would become very fearful in or very anxious.
Okay.
I guess what I'm thinking is just a more general situation that somebody might find themselves in, being anxious about going somewhere, or something where there's a pattern, just more than just a specific situation like the elevator.
Okay.
Yeah.
So how about when you go to, say, for example, family gathering, a party, and you're going into the party and you're feeling a bit anxious about the people that are going to be there?
Okay. So first I would ask you, when did you first notice, like if I were to ask you to flesh out the situation a little bit for me, so would you remember the exact time, the exact date? So just for example, what would it be?
Say I remembered that it was a particular party on a particular date. So maybe it was the last Christmas party.
Okay. And when did you first notice that you started to get anxious?
I was a bit worried about going into the party. So it started probably maybe even a week before the party, as soon as the date was set for the party.
And if we were to try to target one situation where I guess your worry or your anxiety really started to increase, can you think of I guess a specific time? Maybe,
I would probably say maybe 8 o'clock in the evening prior
Okay.
to the party.
Good. And what exactly were you doing at 8 o'clock in the evening?
I was watching television.
Good. Okay. And do you remember what you were thinking about at that time?
I was watching a show
Mhm.
in which there was a party.
Okay. And do you remember the first thought that ran through your head at that time?
The first thought that ran through my head would be something like, oh my gosh, we have a party tomorrow night.
And then what would follow up with that?
How are people going to react?
Yeah.
Are people going to be talking about me? Are there going to be certain cliques of people? Will people invite me and welcome me into the party?
And then once you get to that thought about, will people welcome me, will people accept me, will I have a good time, that kind of idea, can you think of any anxious thoughts that a person might have in that situation? Or I guess any more intense thoughts?
Will I be sitting alone?
Mm-hmm.
Will nobody talk to me? Should I take my spouse with me to feel comfortable?
Okay, so it sounds like at the core of it, you're anxious at the fact that you might be sitting alone, you might be rejected, people might not want to talk to you.
Mm-hmm.
Yeah. Okay. And then as you're thinking about all of that, when you notice that your anxiety is getting really heightened, like really intense, do you notice any changes in your body?
Yes, clammy hands.
Okay.
I may notice my heart rate goes up.
Yeah, good.
I can't think clearly.
Good.
Agitated.
Yeah. And then at the end of all of this, are you still watching TV?
I'm watching television,
Yeah.
but I don't really know what I'm watching.
Okay, good. Okay, so GV, let me walk you through this in terms of how I would relay the situation back to you.
Okay.
Now, first of all, it sounds like we started with a specific situation where it was, I guess the night before the party, 8 p.m. And the first thing that we would look at is what is your behavior?
Okay.
Okay. So that's the first component that we look at. So what are you doing? You're watching TV, right?
Okay.
And then you notice that when you're watching TV, there's a TV show and I guess there's a party,
Okay.
right? And then as soon as you see that party, all of a sudden, let's say your anxiety started to go up a little bit, maybe about 20%, right?
Okay.
And then you started, so sorry, that was your mood. And then you had a thought over here. Oh my gosh, we have a party, right? And then you had the thought, how will people react to me? Well, already it sounds like your anxiety is starting to increase a little bit. So once you have that thought, then your anxiety is going to increase again a little bit, maybe to say about 35%. And then, will people talk about me? And when you hear a lot of statements like that, like, will people talk about me? What if people talk about me? What if there's going to be cliques? That's an indication of worry. Right?
Okay.
So then as you're having these thoughts, your worry is starting to increase, let's say around 30% to 40%, right? And then once your worry is about 40%, your anxiety is about 35%, let's say that the first thing that you start to notice is that your hands start to get a little bit clammy, right? So that's the first thing that happens, and we call this the physiology.
Okay.
Okay. And then once that happens, you have a few more thoughts of, will people welcome me? Will I be sitting alone, right? And then you might have different images in your head about just sitting there being rejected, people not really wanting to speak with you, people even maybe avoiding you. And at that point, let's say it really kicks up your anxiety to say 70%, maybe even 80%, and your worry goes up to about, let's say 70% as well, because you're asking yourself, so what if this happens, what if that happens? You're kind of spinning your wheels and it's getting a little bit worse. And you can see how there's this interplay between all four of these different factors, so that as your anxiety and your worry is really increasing to that degree, you might notice that your heart rate, those changes in your body are really starting to become noticeable. So your heart's just beating and you're really agitated, you can't sit still, right? So what I try to do with people in the first session is I try to show them that